Finding innovative ways to serve rural communities who are facing serious challenges all across the country. RFD-TV's Sarah Monk has more on the intensifying issue in rural communities.
The National Rural Healthcare Association is hosting their annual conference in Washington, D.C. to meet with congressional leaders here in the nation's capital and talk about their priorities going forward and the needs of rural America. We're lucky to be joined here by Tim Putnam. He is the president of that organization. And Tim, talk to us a little bit about, you're here in Washington today. What are you bringing from the Indiana perspective in terms of what needs to happen for rural health?
Well, I think we see a lot of people from across the country really trying to figure out what our challenges are and what message we can bring to the folks on Capitol Hill. As we meet with congressmen, senators, and members of the administration, what are we really facing? And that issue is different from where I see in Indiana, the folks in Alaska, California, Texas, Hawaii, and it's coalescing that voice together, understanding what unique opportunities we have and what our message really should be, what the folks we're trying to serve in our communities are truly facing.
We hear about rural hospitals closing. We hear about kind of a crisis in rural America around health. What do we need in terms of infrastructure to kind of stop that crisis, maybe turn it back?
Well, we have the connection between economic prosperity in an area and the requirement for health. Without health care, without doctors, without nurses, without emergency departments, without the ability for people that live in a rural area to access health, we can't have the infrastructure to build the rest of the economy. We can't have people in an area that are hours away from maternal care, that are hours away from emergent care, to be able to live and thrive and be successful. We've seen the gap in life expectancy between rural Americans and urban Americans growing year after year, and some of that is due to the lack of access to health care in small communities and rural parts of the country.
And of course, another part of this whole equation, which I think both the president and folks in Congress have paid a lot of attention to, is the opioid crisis, which I think people don't always make the connection that the opioid crisis is hitting rural areas particularly hard. Could you just talk a little bit about, what is happening in the rural health space to kind of address that and what more needs to be done?
The very first thing we need to do as healthcare providers is save lives. And then we need to focus on what treatments are available. And they're very different in rural areas than they are in urban areas. Population density, travel issues, a lot of the folks that we find that are addicted and have heroin, opioid addictions, as well as methamphetamines, which is a big issue in rural areas, these folks have very limited access to housing, transportation, and food security. I mean, we're the breadbasket of America and the world, and I've got people not far from me living in the country that have food insecurity because their small town grocery stores have been replaced by convenience stores or closed altogether.
Thanks again to Tim Putnam. He is the president of the National Rural Healthcare Association, who's here in Washington this week to talk about rural health priorities. We'll have more for you throughout the week, but until then, back to you in the studio.
As always, thank you very much, Sarah. Now, in addition to serving as NRHA's current president, Tim is also the president and CEO of the Margaret Health Center in Batesville, Indiana.